It's one of the few disorders that we can fix pretty quickly, so it's pretty rewarding to be able to help somebody immediately and really improve their quality of life very quickly.
I actually have a cousin who is deaf. He has a cochlear implant, and so he was kind of my inspiration when I decided to go into grad school and get my master's, because I wanted to work with cochlear implants. But audiology is a great passion. I can't imagine doing anything else because I'm still very medically connected, but I have a joy helping somebody change their life every day.
But certain key signs that someone would need help would be them asking for repetitions quite frequently, not being able to understand conversations and group noise, and possibly turning up the TV very loud when they're trying to enjoy the television. Those are very common complaints, and then also not really doing well on the telephone.
Sure, as a new patient, it is very easy to get in to see us. You typically would call one of our offices, make the appointment. At that appointment time, we would verify your insurance and tell you what you would expect if you were to need a hearing aid. We would do the diagnostic testing. We'd check your ears, make sure there's no wax in there. We would check the middle ear, so the tympanic membrane, the ear canal, the middle ear space, make sure there's no fluid or blockage that could be causing a problem. And then we would check the nerve function to make sure that the nerve is working the way it should when you're hearing a sound.
Yes, so a lot of people think that hearing loss occurs only in an elderly population, and that isn't true. Hearing loss is one of the #1 disorders of children. So we see everyone from pediatric through geriatric, and it's a pretty even distribution throughout. And in fact, like what we've always recommended to patients, you should be getting a baseline on yourself, your family. My children have baseline hearing tests because you never know when something's going to happen. But everybody needs a hearing test.
We do basically 3 types of testing. We do behavioral testing. That would be the traditional hearing test that you would expect to get in the office. We also do electrophysiology. That looks at nerve function. That someone that may not be able to respond correctly, or even an infant, we could test their hearing and make sure that the nerve is functioning and firing the way it's supposed to the brain. And then we also do balance testing. So that is vestibular system. We look at the inner ear and how it relates to the eye movements and your sense of touch. All those things together determine your balance.
Well, primarily a hearing aid is selected on a clinical basis. We look at their hearing levels, we look at what is needed for that type of hearing loss, and we go from there. All hearing aids are not the same. Certain products and certain brands are meant and focused for certain types of hearing loss. So we help you decide from a discrete set of hearing aids to pick from which ones would be the best performance for that type of hearing loss. After that, we have a lot of experience in the different performances of hearing aids, their longevity, their durability, and actually the clarity of that device. So we can give our best experience approach to which ones work better long term.
So if someone came to me and said, I'm struggling to hear in a crowd, or I'm struggling to hear on the phone, or my wife says I ask them to repeat too often, I would say, come see me. Let me help you figure out what's going on. Let me help you improve your quality of life.
So hearing loss impacts everybody. For pediatric populations, it can create a delay in language development and processing skills. For people that are middle-aged working, it can impact their quality of life, their job performance. And for people that are retired, it can really impact their quality of life and how involved and committed they stay into their interpersonal relationships. So hearing loss impacts a lot of things. According to Johns Hopkins University, there's a 5-fold increase of untreated hearing loss and severe hearing loss together. So we don't want the people we love or even ourselves to go through that. So it's super important to get tested for your hearing loss, both on an emotional level, psychological level, and absolutely a clinical level.